Hey everyone, my name is Melanie Katz and I'm part of the group conducting a literature review on the efficacy of stem cell in tissue and bone regeneration in oral surgery. The field of regenerative medicine has seen a paradigm shift in therapeutic modalities of oral and maxillofacial surgeries, marking the potential of stem cells in tissue and bone regeneration very, very strong. Stem cells are characterized by their self-renewal and differential ability and have surfaced as a promising candidate to address challenges relevant to oral surgery and specifically in the context of tissue and bone renewal. Therefore, the aim of this research project is to study the efficacy of stem cells on bone and tissue regeneration in oral surgery. We aim to identify insight into tissue healing, functional outcomes, patient satisfaction through this literature review. To conduct our review, we set parameters for inclusion and exclusion criteria. To ensure articles were current, the years 2013 to 2023 were set as research parameters in the following databases: PubMed, Web of Science, and Scopus. So we used a 10-year span. The goal was to observe the current and future direction of stem cell research in relation to dentistry and in oral surgery. Only peer-reviewed articles of case-control analytical observational studies were included in the final data, all of which focused on human cases. Our initial database search identified 3,366 articles as being potentially relevant. After removing the duplicates, 2,408 articles were screened via the title and abstract analysis. Based on our exclusion and inclusion criteria, 2,256 articles were removed, giving 152 articles to be assessed for eligibility. A predefined data extraction sheet was used to process selected articles and collect data such as participant age range, study objective, type of stem cells used, type of bone or tissue regeneration, and study outcomes. Post-review and discussion, out of the 2,408 articles screened, 19 articles met the inclusion criteria for this review. So, as previously mentioned, 19 articles met the inclusion criteria. Of these studies, 2 were cohort studies, 7 were case control studies, and 10 were lab-based trials. Successful bone and tissue formation were evidenced in almost all of these studies. An example of application includes use for implant placement and advanced cell therapies, which include stem cells impregnated with different enhancing materials like platelet-rich plasma. PRP, or platelet-rich plasma, may affect soft tissue healing via growth factors released after platelet degranulation and can assist with accelerated blood clotting. To add on, common themes identified include minimal inflammation, which reduces a lot of the complications with the healing process. This was coupled with a lot of implant healing and the revascularization process after the implant placement. In the image to my left, there is an attempt to reconstruct the alveolar bone using bone marrow stem cells impregnated with PRP to allow for successful implant placement and successful osseous integration. Bone marrow stem cells also reduce side effects like ectopic bone growth, pain, and the overall inflammatory response of nasal treatment in the area. Finally, biomarkers such as periostin and Musashi-1 were identified to express their effects on different pathways. This identification can allow for customized genetic therapies to enhance osseous integration and other properties as well. Limitations of the study included only using studies in the English language and only looking at studies that used human subjects. Further research can be conducted to incorporate studies that used more than the English language and to see the use of stem cells in animals, as well as to draw comparison between human and animal studies. In conclusion, these findings have significant implication for advancing regenerative medicine, for correcting craniofacial abnormalities through the advancements in efficacy in bioengineering. Opportunities like getting implant treatment and rebuilding facial structure after a large trauma now have feasible solutions with tissue grafting and bone regeneration. Thank you.